So let's just start by talking about the Doppler. So lots of places to get a Doppler. This happens to be the one I use in my office that I got from Great Lakes Orthodontics. One of the things that I want to do first with a Doppler is I want to make sure and test the batteries. Dopplers can very easily create a lot of false positive background noise as the batteries are starting to die. So the first thing that I do is simply turn the Doppler on and listen. And what you'll notice is you can definitely hear some white noise, some background noise, but we don't hear anything that sounds crunchy or staticky. If we heard that without it touching anything, what it basically means is it's time to replace the 9-volt battery in this. So that's the first thing. The next thing I'm going to do is I'm going to explain to Katie exactly what we're going to hear. So Katie, a normal healthy joint is going to be totally quiet under a Doppler. All you'll hear is this background noise. If we hear anything other than that background noise, then you and I will want to talk about what that means, what's going on inside your joint. Okay? We're actually going to put some jelly on this, just like they do when you have this done. If you want to hear a baby's heartbeat, then sometimes it's a little bit cold and it will definitely be a little bit messy. I'll try to get your hair out of the way as much as possible. So now she knows what we're going to do. And I want to try to isolate some different things when I do this. We talked in the other piece about joint diagnosis, how important it is to understand where we hear the joint noise. Is it on rotation, telling me there's something going on with the medial aspect of the disc, or is it on translation, telling me it's a lateral aspect of the disc? Those are two totally different patients. They have different risks from a restorative perspective, and they have different futures and outcomes from a standpoint of treating their joints and getting them asymptomatic. So that's going to be important. How I'm going to do that is I'm going to ask Katie to do some very specific movements for me so that I can isolate those sounds. So as we get started, what we're going to do is first, I'm going to make sure the Doppler's on, but I turn the noise all the way down so it's not distracting. I actually put the Doppler jelly right onto the head of the Doppler. And as you can see, you want a really generous amount, okay? Really critical that the actual head of the Doppler never touch Katie's skin, that the sound is being communicated through the jelly. So I need at least a good 1/4 inch of that between her skin and the head of the Doppler. Next thing I'm going to do is I'm going to have her turn her head away from me just a little bit, and I am going to just sort of sneak her hair out of the way as best as possible. I want to remind myself where the lateral pole of her condyle was. So I'm going to actually ask her to open and close once, and close, and find the lateral pole of her condyle. Now I'm going to actually put the Doppler in place just behind that, and as you can see, not touching her skin. And now I can hear her superficial temporal artery. That tells me I'm in the right place. So now what I'm going to do is I'm actually going to tip the Doppler forward until I lose the sound of the artery. And I'm going to actually ask Katie to open and close 3 times so I hear a lot of scratching so that I can get to the loudest spot. Go ahead and open really fast for me 3 times. Perfect. So now I'm going to turn the sound down for a second so we can talk. What you'll notice is I ask Katie to move quickly, because when she moves quickly, I hear a lot of crunching noises. That's actually turbulence in the synovial fluid because she's moving so quickly. When I actually do the Doppler exam, if she moves too fast, I will think I hear crepitus, but it's a false positive. So I'm going to have to actually control her movements now. So the first thing I want to do is listen to rotation. So I'm going to just simply ask Katie to only open about a 1/4 inch, and when she closes, not to actually touch her teeth together, because you can often think that that's a pop or a click when you hear the clack of the teeth coming into contact. So you ready, Katie? All right. So just about a 1/4 inch, and close without touching, and open, and close, and open, and close. All right, and so Katie's joint is totally normal in rotation. Another way to isolate rotation would be to have her do a working side movement. So I could ask Katie to move her jaw toward me. So Katie, now go slowly, about a second over to the right, and back. And over to the right, and back. One more time, and back. Okay, now I can listen to translation. So now what I'm going to do is I'm going to have Katie open to the full extent, but I'm only going to pay attention after she gets out of rotation. So Katie, take about a second to open and a second to close, but open to the full extent that you can. 1/1000 open and close. And 1/1000 and close. So this is a perfect example of one of those unexpected joint sounds. So Katie's history was negative from a pop and a click. We didn't feel a pop or a click, but Katie has very definitive crepitus on translation, telling us without a pop or a click that she's off the lateral pole of the disc on this side, and it doesn't reduce. So we would call this a lateral pole disc displacement without reduction. Now, those findings of her load test become even a little more fuzzy, because now we do know she is capable of pinching retrodiscal tissue, although not classically in a seated position, but in excursions. So a finding of her telling me that she has discomfort on this right joint in a lateral movement would not be unexpected. So let's verify translation by having her do a translatory movement on this side, meaning moving away from the Doppler. So Katie, I'm going to have you move to the left about a second over and a second back. And back. And a second over and a second back. So she has that same crepitus on translation in her lateral movement as she does in her wide opening. So then we're just going to remove the Doppler gel, and classically, if we were doing a full exam on Katie, we would repeat that on the other side.